Welcome back. Coronavirus cases in the United States are surging in places where vaccination rates are low. Louisiana, Florida and Texas, for example, where there are currently more than 12,000 new infections a day. Calls for mask and vaccine mandates have gained popularity throughout the US as a number of private businesses and federal entities are requiring their employees to be fully vaccinated. However, several Republican state leaders are implementing rules against mask mandates and vaccines. Here's what the governor of Texas had to say last week.
In Texas, there will not be any government-imposed shutdowns or mask mandates. Everyone already knows what to do. Everyone can voluntarily implement the mandates that are safest for them, for their families, and for their businesses.
Governor of Texas. So how is the medical community reacting to those mandates? We're joined now by Owais Durrani, who's a doctor in the emergency medicine physician in Houston, Texas. We appreciate you talking to us, Dr. Durrani, what is an extremely busy time. Paint a picture for us, if you would. What's the COVID situation like now in Texas compared with at other points in the pandemic?
Yeah, thanks for having me. I'd say, the situation is grim. We've had many weeks of increasing cases, increasing hospitalizations, and now our ICUs are full. This morning, I was kind of looking at some of the reports, and 53 of our ICUs in the state of Texas are completely full, and those in cities like Austin and Houston are in the single digits when it comes to how much availability we have. When I walk into the emergency department, it feels like I'm transported back to a year ago. We have patients that I admitted 3-4 days ago who are still stuck in the emergency department because the hospitals are so full. They don't have room to move them upstairs into the ICUs where they can get the appropriate care that they need. And we've seen study after study showing that emergency department boarding leads to poorer outcomes for patients. I also occasionally work in some critical access hospitals in kind of rural areas where the job is to get patients in, stabilize them, and transfer them out. They can't be transferred out because no hospitals have room for those patients to go to. And so that's going to lead to suboptimal care as well, because those patients can't see the pulmonologist, the cardiologist, and other specialists that they need to see. This is all while we have less than half of our population in the state of Texas vaccinated. We cannot use mask measures because the governor put into order a ban on those. And then kids are going back to school starting this week and throughout August. And so that's going to lead to more spread of this surge and kind of, more issues for us.
Who is it that you're seeing admitted to hospital now? Tell us the sort of profile of the average patient, if you can.
Absolutely, yeah. I think back to a year ago, and the profile was kind of the nursing home patient, 70 plus, numerous comorbidities. That was kind of the profile. Now I'm seeing a bunch of 40 and 50-year-olds who may have no or one medical condition, and they come in really short of breath. They need high levels of oxygen, and they get admitted to the hospital. Last year, we were seeing almost none of those patients being admitted to the hospital. So it's another testament to how more dangerous and how much more transmissible this virus is and how important the vaccine is to prevent the types of patients that we're admitting to the hospitals right now.
How many of those patients tend to be vaccinated?
Personally, I have not had a single patient that was vaccinated that I needed to admit to the hospital. I know there are some rare cases where they need to be admitted to the hospital, but the ones that I'm dealing with and my colleagues are, most of those are unvaccinated. And it's unfortunate because vaccines are so widely available now, and you can get them essentially at every street corner, every pharmacy you go to.
You mentioned the mask mandates and how some politicians have banned the requirement being made by government entities and some large employers. One of the governors in Arkansas seems to have regretted these mask banning mandates. Any sign that Greg Abbott, the governor of Texas, might feel similarly now?
I hope he comes around to that similar sentiment and does allow masks in schools and public places that are crowded. It's the one tool that we've had for the past year and a half that works. It's only second to vaccines at this point. And we all know that you can't vaccinate yourself out of a surge. We've seen that in India. We've seen that in the United States and many other countries. So while we catch up on the vaccinations, we really need social distancing and masking to mitigate the spread of this virus even more and save lives. So I really, really hope he takes the lead from that governor and he changes his mind on this.
Dr. Owais Durrani from Houston in Texas, thank you very much.
Thank you.